Morning, dear student. Today the third lecture, breast and bottle feeding on infant. Fun lecture you can see at the slide. So, breastfeeding. Breastfeeding is a type of feeding when the main source of nutrition for a baby in the first year of life is mother's milk. World Health Organization recommends exclusive breastfeeding starting within 1 hour after birth until a baby is 6 months old. Nutritious complementary foods should then be added while continuing to breastfeed for up to 2 years or beyond. So, breast milk contains everything the baby needs for the first 6 months of life, in all the right proportions. Its composition even changes according to the baby's changing needs, especially during the first months of life. Breast milk helps to lower the risk of or protect against diabetes, gastroenteritis, diarrhea, asthma, allergies, urinary tract infection, chest infection and wheezing, ear infection and obesity. The program on promotion, protection and support of breastfeeding by World Health Organization and UNICEF. So names 10 steps to successful breastfeeding. There are have a written breastfeeding policy that is routinely communicated to all healthcare staff. Train all care staff in skills necessary to implement this policy. Inform all pregnant women about the benefits and management of breastfeeding. Help mothers initiate breastfeeding within a half hour of birth. Show mothers how to breastfeeding and how to maintain lactation even if they should be separated from their infants. Next steps to successful breastfeeding. Give newborn infants no food or drink other than breast milk unless medically indicated. Practice rooming in. Allow mothers and infants to remain together 24 hours a day. Encourage breastfeeding on demand. Give no artificial tests or pacifiers, also called randomness or source to breastfeeding infants. Foster the establishment of breastfeeding support groups and refer mothers to them on discharge from the hospital. Types of breast milk produced. There are three types of breast milk depending on the term after delivery. During the last weeks of pregnancy and the first few days after delivery, the colostrum is excreted from the breast. Then from 6 to 15 days, the transitional milk is produced. And from the 15th day after delivery, the mature milk is generated. So, in the next slide, you can see according the types of the breast milk produce a different between all types, between the colostrum, transitional, and the mature. According the color, according the composition, according the energy. For example, colostrum yellowish, transparent. Transitional more milky but still watery looking, and mature skim milk appearance. According the composition, and the colostrum more protein, less carbohydrate, less fat. In transitional, high protein, more carbohydrate and more fat. And according to the mature milk, the low protein, the more carbohydrates and more fats. And energy. In 100 milk, in 100 colostrum, 150 kilocalorie. And transitional meal energy 60 to 80 kilocalorie in 100 ml. And according to the mature milk, energy 65 or 70 kilocalorie and 100 ml. So, some information, more information according to the colostrum, for example. During the first days after birth, the breasts produce a thick and yellowish fluid called colostrum. It's high in protein, I said before, and low in sugar and loaded with beneficial compounds. Colostrum is the ideal first milk and helps the newborn's immature digestive tract develop. The colostrum contains higher amounts of white blood cells and antibodies than mature milk and is especially higher in immunoglobulin A, which causes the lining of babies' immature intestines, helping to prevent germs from invading a baby's system. Secretory immunoglobulin A also works to help prevent food allergies. After a baby has been nursing for 5-6 days, the colostrum in the breast slowly begins to the process of changing into mature breast milk over the next 2 weeks. So, feeding a child during the first year with the milk from the mother's breast is called natural or breastfeeding. Breast milk is the perfect food for a newborn. It is the best gift a mother can give her baby. The composition of human milk is ideal for most infants. Breastfeeding has been encouraged mainly for its psychological advantages, economy, and aesthetics. It contains all the nutrients for normal growth and development of a baby from the time of birth to the first 4 to 6 months of life. So please turn attention to this slide. What's in a drop of the good stuff? Here are just some of the life-giving components in the one drops: water, proteins, lactose, essential fatty acids, antibodies, hormones and the growth factors, millions of the life cells like stem cells and white blood cells, as many as 800 strains of good bacteria, antibacterial and antiviral enzymes, vitamins and minerals. So, more information about the main nutrients from the mature milk. Protein quantity approximately 0.91.3 grams per 100 ml. The ratio of albumin, globulin, and casein in breast milk is 80 to 20, and in cow's milk the opposite is. Therefore, a lower clot is formed when milk is curdled in the stomach, easier digestion and absorption, faster evacuation from the stomach. Alpha-lactalbumin predominance, which is absorbed unchanged, which makes it easier for the absorption and digestion. The content of amino acid is less than in cow's milk, but they're in an optimal ratio. The taurine content is higher than in cow milk. Taurine stimulates the growth and differentiations of the retina, nerve tissue, adrenal glands, pineal glands, pituitary glands, stimulates the phagocytic activity of neutrophils, antioxidant and membrane stabilization effect. Participates in the conjugations of bile acids. Quantity 0.9, 1.3 grams per 100 ml. The ratio of albumin, globulin, and the casein in breast milk is 80 to 20, and in the cow's milk the opposite is. Therefore, a loose clot is formed when milk is curdled in the stomach, easier digestion and absorption, fast evacuation from the stomach. The content of amino acids is less than in the cow's milk, but they are in optimal ratio. The taurine content is higher than in cow. Taurine stimulates the growth and differentiation of the retina, nerve tissue, adrenal glands, pineal glands, pituitary glands, stimulates phagocytic activity of neutrophils, antioxidant, membrane stabilizing effect. According to the facts, Quantity 3.9, 4.5 gram per 100 ml. The main components are triglycerides, phospholipids, fatty acids. The content of polysaturated fatty acids reaches 50% omega-3 and omega-6. Higher phospholipid content. Linoleic acid regulates the vascular permeability. Galactosides and cerebrosides are involved in the myelination of nerve fibers. High activity of the lipase enzyme than in cow's milk. In some women, the concentration of fat in milk at the end of the feed in 4-5 times higher than at the beginning. Fats quantity 3.9, 4.5 gram per 100 ml. The main components are triglycerides, phospholipids, fatty acids. The content of polysaturated fatty acid reaches 50%. There are omega-3 and omega-6. High phospholipid content. Linoleic acid regulates the vascular permeability. Galactosides and cerebrosides are involved in the myelination of nerve fibers. High activity of the lipase enzyme than in cow's milk. In some women, the concentration of fat in milk at the end of the feed in 4-5 times higher than at the beginning. So, carbohydrates. Carbohydrates, a quantity 6.8 to 7.2 grams per 100 ml. Carbohydrates in breast milk are represented by beta-lactose, approximately 90%. So named the bifidus factor is slowly broken down in the large intestine. Part of it is hydrolyzed into glucose, and galactose reaches the large intestine. Human milk oligosaccharides, carbohydrates with prebiotic properties, which are necessary for the nutrition of bifidobacter and lactobacillus. HMO, human milk oligosaccharides, carbohydrates with prebiotic properties, which are necessary for the nutrition of bifidobacter and lactobacillus. So, human milk oligosaccharides enhance the barrier function of the intestines, providing a protective effect on the mucous membranes, protecting them from the attacks of possible viruses and bacteria. Due to the fact that there are different types of oligosaccharides, they are able to catch different bacteria. The microbe does not attach to cells of the body, but to human milk oligosaccharides and cannot cause disease. Breast milk oligosaccharides help to the proper development of immunity by interacting with cells involved in the formation of the immune defense of the child's body. They train and develop the baby's immune system, protecting against diseases and in case of their occurrence, helps the body to fight them on its own. So human milk oligosaccharides enhance the barrier function of the intestines, providing a protective effect on the mucous membranes, protecting them from the attacks of possible viruses and bacteria. Due to the fact that there are different types of oligosaccharides, they are able to catch different bacteria. The microbe does not attach to a cell of the body but to human milk oligosaccharides and cannot cause diseases. Breast milk oligosaccharides help the proper development of immunity by interacting with cells involved in the formation of the immune and defense of the child's body. They train and develop the baby's immune system, protecting against diseases and in case of their occurrence, helps the body to fight them on its own. Breast milk contains 15 minerals. Their content is 3.5 times lower than in cow milks. For example, natrium is 4 times less than in cow milk, but it's very, very good because the low osmolarity and consequently a decrease in the load of the excretory system of the newborn, and in the future the prevention of hypertension in adolescents. Mineral substances are in proportions that are optimal for the absorption and mineralization of bone tissue. The ratio of calcium and phosphorus is 2:1. In this connection, the coefficient of absorption of calcium is 50-70%. The higher content of trace elements, copper, zinc, iron is characterized by greater digestibility due to the presence of the protein lactoferrin. So, breast milk contains 50 minerals. Their content is 3.5 times lower than in cow milk. Natrium is 4 times less than in cow. It's very, very good because a low osmolarity and consequently a decrease in the load of the excretory system of the newborn, and in the future the prevention of hypertension and adolescence. Mineral substances are in proportions that are optimal for the absorption and mineralization of bone tissue. For example, the ratio of calcium and phosphorus is 4:1. In this connection, the coefficient of absorption of calcium is 50-70%. The high content of trace elements, copper, zinc, iron is characterized by a greater digestibility due to the presence of the protein lactoferrin. So, fat-soluble vitamins A, E, D are presented in the sufficient quantities. They serve as membrane stabilizers. Vitamin D regulates the absorption of calcium and phosphorus. Less water-soluble B vitamins. Vitamin C 5 times more. Carotene is present as it prevents cholestasis and the joints. The contents of hormones, enzymes, and retinol and alpha-tocopherol. So, according to the immunobiological factors of mother's milk, first of all, the higher content of immunoglobulin A is most in colostrum. There is a high content of lactoferrin. There is enzyme lactoperoxidase destroys Streptococcus, Enterococcus, E. coli. The human milk contains anti-staphylococcal factors, which suppress enzyme systems of Staphylococcus. Higher concentration of bifidus factors in human milk, 40-100 times bigger than in cow's milk. So, immunological factors of mother's milk. A higher content of the immunoglobulin A, there is a higher content of the lactoferrin, there is enzyme lactoperoxidase, destroys the Streptococcus, Enterococcus, E. coli. The human milk contains anti-staphylococcal factors which suppresses enzyme systems of Staphylococcus. Higher concentration of bifidus factor in human milk. So, the role of cellular factor in forming the antibacterial immunity is of great importance. B lymphocytes synthesize immunoglobulins. T lymphocytes implement the cellular immunity. Macrophages produce complement lysozyme lactoferrin. Para-amino benzoic acids provides protection against malaria. Breastfeeding protects against neonatal hypocalcemia and tetania, deficiency of minerals, and celiac diseases. So breast milk contains important antibodies. Breast milk is loaded with antibodies that help baby fight off viruses and bacteria. This particularly applies to colostrum, the first milk. Colostrum provides a high amounts of immunoglobulin A, I repeat again, as well as several other antibodies. When the mother is exposed to viruses or bacteria, she starts producing antibodies. These antibodies are then secreted into the breast milk and passed to the baby during feeding. Immunoglobulin A protects the baby from getting sick by forming a protective layer in the baby's nose, throat, and digestive system. So breast milk is loaded with antibodies that help baby fight off viruses and bacteria. This particularly applies to colostrum, the first milk. When the mother is exposed to viruses or bacteria, she starts producing antibodies. These antibodies are then secreted into the breast milk and passed to the baby during feeding. Immunoglobulin A protects the baby from getting sick by forming a protective layer in the baby's nose, throat, and digestive system. So, for this reason, breastfeeding mothers with the flu may actually provide their babies with antibodies that help them fight the pathogen that is causing the sickness. Nonetheless, if mother's ill, she should always practice a strict hygiene, wash hands often, and try to avoid infecting baby. Formula doesn't provide antibody protection for babies. Numerous studies show that babies who are not breastfed are more vulnerable to health issues like pneumonia, diarrhea, and infection. So, the advantages of breastfeeding. The early begins of breastfeeding is better for mothers and babies' health. Sucking makes mother's organism produce oxytocin. It makes the womb contract and so prevents uterus bleeding after delivery. Besides, lactation sets up early and for a longer period, and hardening of mammary glands is less painful. Lactation suppresses ovulation and serves as an effective contraceptive. The early begins of breastfeed is the better for mothers and babies' health. Sucking makes the mother's organism produce oxytocin. It makes the womb contract and so prevents a uterus bleeding after delivery. Besides, lactation sets up earlier and for a longer period, and hardening of mammary glands is less painful. Lactation suppresses ovulation and serves as an effective contraceptive. Breastfeed promotes close physical and emotional bonds between the mother and the baby. Sucking reflex settles faster and the normal and intestinal microflora formed if a child is breastfed soon after the birth. There is low risk of infection of child. The sterility and adequate temperature of breast milk. Psychological adaptation of breast milk and physiological adaptation of the breast milk to the need of her baby. Breastfeed promotes close physical and emotional bonds between the mother and the baby. Sucking reflex settles faster and normal intestinal microflora formed if a child is breastfed soon after the birth. There is a lower risk of infection of child. The sterility and adequate temperature of breast milk. Physiological adaptation of breast milk to the need of her baby. Breastfeed protects from allergy of newborn. There are also many health benefits for mothers because breastfeeding does the following. Burns more calories and helps to get back to pre-pregnancy weight quicker. Reduce the risk of ovarian cancer and breast cancer in premenopausal women. Pulse bone strength to protect against a bone fracture in older age. Helps the uterus to return to its regular size more quickly. Burns more calories and helps to get back to pre-pregnancy weight quicker. Reduce the risk of ovarian cancer and breast cancer in premenopausal women. Builds bone strength to protect against bone fracture in older age. Helps the uterus to return to its regular size more quickly. Continue according benefits of the breastfeeding. Delays the return of a menstrual period, which may help to extend the time between pregnancies. Keep in mind that breastfeeding alone will not prevent pregnancy. Adults who were breastfeeding turned out to have better sexual potential and fertility. Breastfeeding prevents the development of atherosclerosis and hypertension when a child reaches middle or elderly age. There is a return of a menstrual period, which may help to extend the time between pregnancies. Adults who will breastfeed turned out to have better sexual potential and fertility. Breastfeeding prevents the development of atherosclerosis and hypertension when a child reaches middle or elderly age. Psychological benefits of breastfeeding. Breastfeeding may have psychological benefits for the infant as well, creating an early attachment between mother and child. Tender mothers look, her kind voice and words, her smells, touch of her hands contribute to correct behavioral feeling in baby. Numerous investigations in this field show that breastfeed infants usually are more kind and more human in the future. Breastfeeding becomes more than a way to feed a baby. It's a source of warmth and comfort. But in not all percent cases, breastfeeding is possible. There are several reasons why a mother may not breastfeed her baby. It's maybe medical or other health reasons may prevent a mother from breastfeeding. The baby with special requirements may not tolerate breast milk. Some social or psychological reasons can make it more difficult to breastfeeding exclusively. So, medical contraindications to breastfeeding connected with mother. It's decompensated chronic diseases like blood circulation insufficiency, kidney or liver problems, respiratory insufficiency of third grade, HIV infections, and other. Physical disorders as epilepsy, schizophrenia, depressive psychosis, postpartum psychosis, taking certain medication, and substance abuse. Medical contraindications to breastfeeding connected with mother. Decompensated chronic diseases like blood circulation insufficiency, kidney or liver problems, respiratory insufficiency of third degree, HIV infections, psychical disorders as epilepsy, schizophrenia, depressive psychosis, postpartum psychosis. Taking certain medication and substance abuse. So the relative contraindications to breastfeeding. Active forms of mother's tuberculosis. The child is isolated from birth till 1/2 months and fed with processed milk. Syphilis is infected after 6-7 months of pregnancy and the newborn is symptom-free. Epidemic typhus and relapsing fever. Stop breastfeeding in root causes in light continuum if possible, provided that disinfection. Typhoid fever, paratyphoid, and dysentery root causes temporarily stop light feed with processed and boiled milk. Virulent mastitis. So, other reasons why a mother may not breastfeed her baby. For example, working outside the home makes it more difficult to breastfeed exclusively, especially if there is no support at her workplace for her to either bring her baby or to express and store her milk. Choosing not to breastfeed for personal reasons, either from the birth of the baby or after breastfeeding for a short while, is a mother's prerogative. So, how to assess the effectiveness of breastfeeding? Signs of a well-fed newborn. At least 8 breastfeeds every 24 hours, approximately 10-12 in newborns. Obviously, swallowing during the feeds seems happily satisfied after the feeds. No meconium faces by days 5, no constipation, adequate diuresis, 6 to 8 wet clothes and diapers in 24 hours. Baby should regain his weight both by the second week. Gain at least 110, approximately 200 grams per week after the 4 days of life. After gaining 100, 200 per week and approximately 600 to 800 grams per first month. The average breastfeed baby doubles birth weight in 5-6 months approximately. So, signs of an underfed baby continues to lose weight after days 5. Below birth weight at day 14, gaining less than 500 to 600 grams per first month, less than 6 wet naps daily, oliguria, urine that is yellow and strong smelling, and frequent dry, hard, green stools or constipation, worried looking face, unusually lethargic and sleepy, weak cry. So, next part from next question from our lecture: bottle feeding, artificial feeding, and mixed feeding. Artificial feeding. What is artificial feeding? Feeding the baby only with infant formula. Mixed feeding. Feeding a baby with breast milk, including mother's expressed or donor milk, and any combination with adapted milk formula. Artificial feeding, feeding the baby only with infant formula. Mixed feeding, feeding a baby with breast milk in any combination with an adapted milk formula. So, if breastfeeding is not possible, infant formula can be fed to an infant by bottle. Hospitals that are accredited by the World Health Organization are tolerant of formula feeding, but do not offer it to infants who can be breastfed. Most formula available today has cow's milk as its main ingredient. The protein in the milk is significantly altered to make it easier to digest, because the young babies won't be ready to digest regular cow's milk until after his first birthday. So, classification and characteristics of milk formulas for mixed and bottle feeding. All formula of feeding infants are divided into two large groups by consistency. There are powder and liquid. Each of these groups by pH is divided into natural or sweet and sour or acidophilic. Each of these subgroups is divided into formula without preliminary protein processing, simple formula, and formula with preliminary spatial processing of protein, adapted formula. And we can say about non-adaptive formula in case if it's a milk from agricultural animals. So, classification and characteristic of milk formulas for mixed and bottle feeding. All formula for feeding infants are divided into large groups by consistency, powder and liquid. Each of these groups by pH is divided into natural sweet and sour or acidophilic. Each of these subgroups is divided into a formula without preliminary protein processing, simple formula, and a formula with preliminary spatial processing of protein, adapted formula. And milk from agricultural animals is a non-adapted formula. So, the basic formula is maximally close to a woman's milk content and corresponds to the peculiarities of infant's metabolism. It is used for infant feeding. Figure first indicated basic formulas. Examples of the basic formulas: NAN1, Nutrilon1, HIP1, Trisolac1, Humanalign, Lazana1, Ditalac1, Nutrilact1. The basic formula is maximally close to a woman's milk content and corresponds to the peculiarities of infant's metabolism. It is used for infants feeding, and figure 1, figure first indicated the basic formulas. The follow-on formula is used for infant feeding from 6 months of life and characterizes less degree of adaptation, less close to the breast milk. The energy value and the content of protein are higher than in baby's formula. That corresponds to the growing requirements for nutrients and energy of a second half year old. The follow-on formula has a higher content of iron, one of the effective ways of preventing the iron deficiency anemia, which often occurred in infants of the second half year of life due to running out of iron depot stored during fetal life. The following one formula contains all necessary vitamins and minerals for the second half year child. Figures 2 and 3 indicate the follow-on formula. For example, HIP2, NAN2, Nutrilon2, Tetalac2, and other. So there are universal formula for feeding a healthy infants and formula for infants with special nutrition needs. According to special nutritional needs, specialized formulas, for example, for premature and low birth weight babies, often contain more calories and protein, as well as more easily absorbed types of what called medication triglyceride. Examples: Similac Special Care, Enfamil Premature, Similac Expert Care Neosur, Frisopre, Humana H0. So, opposite formula. If baby has trouble digesting cow's milk protein, if baby has colic, if parents are a vegan, these are made with a plant protein that is modified for easy digestion by babies. Examples: non-soy, Similac Isomil, Nestle Good Start Soy, and other. Other examples: specialized formulas. Lactose-free formula, in which the lactose is replaced with a different sugar, such as corn syrup. Some babies may not have enough lactose. The enzyme used to digest the milk sugar lactose, if baby is lactose intolerant or unable to digest lactose. For infants with diarrhea, galactosemia, celiac disease, because these babies don't digest milk sugar well, they may be fussy or cry, especially colic. Lactose-free formulas may help these babies cry less and feel more comfortable. For example, Similac sensitive, Enfamil lacto-free. Hypoallergic formulas. Some babies are allergic to both cow milk proteins and soy proteins. Hypoallergenic formulas contain pre-digested proteins, so babies who are allergic to milk proteins are usually able to tolerate hypoallergenic blends. These products are also lactose-free. Humana hypoallergenic, Similac alimentum, and others. And metabolic formulas recommended if baby has a disease that requires very specialized nutrition. Infants with phenylketonuria, for example, phenylalanine-free formula. For example, phenyl-free, Afinilac, or other. Extensively hydrolyzed formula. In this, the protein is broken down into smaller parts that are easy for baby to digest. If baby has an allergy or trouble absorbing nutrients. Some babies with severe stomach problems may not be able to break down even the predigestive proteins found in hypoallergenic formulas. For these infants, a formula that contains free amino acids may be the only option. Amino acid formulas are suitable for children who have severe or life-threatening food allergies, who have had surgery on their intestines, or who have other severe gastrointestinal problems. These products are lactose-free and may contain special fats for children who have difficulty absorbing fats from regular formulas. Formulas with probiotics and prebiotics. There is insufficient evidence to determine the role of prebiotic supplementation of infant formula for prevention of allergic diseases and food hypersensitivity. Supplementation of infant formula with prebiotic describes losses reported a reduction in eczema in high-risk formula-fed infants. So the main steps to creating a breast milk substitute are the directions of cow milk adopting as follows. Lowering of general protein content, correction of protein and amino acids content, a team of whey proteins, cysteines, and others. Increasing the level of general lipids and carbohydrates, optimization of fat acids and carbohydrates content, lowering the amount of the calcium, kalium, natrium, enriching with a complex of vitamins, mineral salts, or micronutrients, increasing the amount of bifidobens and protective factors, inserting taurine, carnitine, inosite, polynucleotides, and other biological active connections. So, complementary feeding of a child of the first year of life. All products except for human milk and infant's formula supplement the diet with nutrients necessary to ensure the future growth and development of the child. The digestive systems of babies will become ready for solid food by 6 months. They will also be able to have the physical skills of swallowing solid foods by that time. Solid foods for infants should start when baby shows signs of readiness. Supplementary food of a child of the first year of life. All products except for human milk and infant's formula supplement the diet with nutrients necessary to ensure the future growth and development of the child. So, why does a child need new food? To develop mature eating habits typical of an adult, the child must move from sucking the breast to the increasingly complex work of moving food with the tongue, chewing it, beating off a oval piece, and other. Expansion of the diet is caused by the need for additional introduction of nutrients, the intake of which only with human milk or infant formula becomes insufficient. The child begins to feel the need for a wide range of minerals, iron, zinc, calcium, potassium, vitamins, other nutrients, protein, carbohydrates, dietary fiber. The receipt of an additional amount of energy necessary for its further future growth and development. So, the World Health Organization recommends feeding the baby exclusively with breast milk for the first 6 months of life. And after 6 months, is gradually introduces new foods, complementary food, into the baby's diet. Rules for the introduction of complementary foods. Complementary foods are administered only to healthy children with well-functioning intestines. Guidelines. The introduction of each new product from a small amount gradually in 5-7 days is increased to the required volume, and a gradual change in the consistency of the new product. The introduction of a new dish takes about 4 weeks, completely displacing one feeding with milk while carefully monitoring the tolerance. A new product dish should be given in the morning in order to note a possible reaction to each introduction. Cereals, fruit and vegetable juice and purees begin to be introduced with monocomponents products. After making sure of its good tolerance, they are gradually offered to the child a mixture of two or more products of these groups. Complementary food are given from a spoon before breastfeeding or infant formula in the same feeding. With age, you should move onto a thicker and the later dense food. Complementary foods should be semi-liquid, well wiped, and should not cause difficulty in swallowing. Complementary foods must be freshly prepared and served in a beautiful container. Two new types of complementary foods must not be introduced at the same time, and too thick or too liquid meals must not be combined in one feeding. New foods are not introduced if the child is sick and during the period of preventive vaccinations, during travel changes of residence. Complementary foods can be prescribed during the recovery period but with a stable stool. Next rules, portability. The important thing is how the child learns the new dish. The indicators of the tolerance of complementary food are no regurgitation, no changes in the stool, both in frequency, in the quality, no skin changes, good appetite, good emotional tone. The resulting indicators of good tolerance and assimilations of complementary foods are positive dynamic physical and neurophysic development of the child. The sequence of the introduction of individual products and dishes depends on the state of health, nutrition status of the child, and the functional state of his digestive system. For children with a reduced body weight, frequent stools, the first main complementary food, industrial porridge enriched with iron, calcium, zinc, iodine, with paratrophy and constipation, vegetable puree. For children who are artificially or mixed feeding with adaptive formulas, complementary foods are introduced at the same time as children who are fed with breast milk. So, in this table, approximate arrangement of products and wings when breastfeeding, artificial or mixed feeding. Products of wings and feeding correction, age and amount, some or another food. So, at this slide, you can see babies weaning at 6 months approximately. Which vegetables, which fruits are possible for baby at 6 months. Foods should be smooth, soft, and fine in the texture. the poor slides of the spoons. Porridge, rice cereal, mashed carrot, mashed broccoli, mashed pumpkin, apple puree, pear puree, scarred banana, scarred papa, spinat puree. So next slide, the same, which vegetables, which fruits and grains possible for the baby during the second half year. You can recommend the sweet potato, carrots, pumpkin, green beans, avocado, banana, apples, peach, and baby cereal, rice, oatmeal. And next slide, the same information according the baby's development stage, approximate food texture, and examples according to some foods possible to the baby at some or another age, month. So, methods of the counting the daily volume of feeding. For newborn first days of life, a necessary amount of food you can calculate by Zaitseva's formulas. Daily volume, it's 2% of body weight at birth, multiply n, in which in these formulas, n is a day of life. Daily volume, it's 2% of baby's weight at birth, multiply n. And it's a day of life. These formulas, I'm turning attention the possible for the newborn baby, the first days of life after birth. So, next method for the calculation, necessary volume, calorie method. For 1 kg of weight, the child should receive from birth to 6 months 115 kilocalories by kg by day. From 6 to 12 months 110 kilocalories by kg day. Meaning that 1 liter of breast milk contains approximately 700 kilocalories. Count the necessary feeding volume. Volume is A multiply B multiply 1000 divide and 700. A, it's a calorie by kg requirement. B, it's a weight in kg. Multiply 1000 and divide and 700. And volume method for the calculation necessary daily amount. Age and weight is taken into consideration. From the 2 weeks till 1.5 months, 1/5 weight. 1.5 months to 4 months, 1/6 weight. From the 4 till 6 months, 1.7 weight, and older than 6 months, 1.8 weight. And I'm turning attention that the maximum daily volume should be 1000 ml, not more. Not more. It's very, very important. Please turn your attention. Child's necessary of the nutrients, proteins. For the baby first 3 months, 2.2 grams by kg by day. From the 4 till 6 months, 2.6 grams by kg by day. And the second half year, 2.9 grams by kg by day. From the month to the month, the requirement in the proteins increase. Lipids, fats, for the first 3 months, 6.5 gram by kg by day. Second 3 months, 6 grams by kg by day. And the second half year, 5.5 grams per kg by day. From the month to the month, the requirement in the lipids on the fats decrease. And carbohydrates is a constant. During the first year, 13 grams by kg by day. About the feeding frequency regime. From birth to 2 months, 7 times approximately, 3 hours break. From the 4 till 4 months, 6 times approximately, 3.5 hours break. And from the 5 till 12 months, 5 times, 4 hours break. The first feeding at 6 a.m. At next slide, an example of making a menu for a child at 4 months with a birth, for example, weight of 3 kg. First of all, calculate the body weight necessary. 3 kg plus 4 multiply 0.8 grams. It will be 6.2 kg. Second, calculate the daily volume by 2 methods. First of all, 1/7 according to 4 months, 1/7 part from the weight, from the 6.2 kg. It's a total amount 900 ml. And the second method, 150, it's required multiply B, multiply body weight, 6.2 kg, multiply 1000 ml, and divide in the kilocalorie, 700 kilocalorie, together 1000 ml. And find a 1 times volume, approximately 160 ml. And making the menu. And simple menu for a 4 months old baby weight 6.2 kg. For this age, possible only breastfeeding, for example. Each feeding, it will be breast milk, the same amount, the break, total of frequency 6, and break 3.5 hours. Simple menu for a 6-month-old baby weight 7 kg, for example. Total frequency 5, break between the feeding 4 hours, and at this age the possible weaning or complementary food. We can recommend the weaning vegetable puree during the second feeding at 10 a.m. Other feedings, it's a breast milk. My lecture is over. Thanks for attention.